Well, Mary, other than that rash, you're in great health.
Okay, doctor. What should I do about it?
I want you to go to dermatology. Make an appointment for them to look at it.
Where's that department?
It's on the 3rd floor. Turn right when you pass the radiology department.
Great. I'll head up there now.
But first, you should refill your prescription at the pharmacy.
The pharmacy is downstairs, right?
Yes, next to the emergency room.
Dr. McNeil, could you come over here for a second?
Sure, Carol. What do you need?
I just took Miss Grayson's blood pressure. It's 150/92.
That's a bit too high.
Yes, I thought so too.
Who's her cardiologist?
Her chart says it's Dr. Sarton.
He'll want to know about this.
I'll let his office know to set up an appointment.
Good idea. Thanks for consulting me.
Gary, have you done your supply checks for the day?
Yes, I just finished them up.
Are we short on anything?
Yes, we need some more latex gloves in exam rooms 1 and 3.
Okay. Anything else?
There are only a few syringes left in the storage closet.
Okay, I'll have to order some of those. That reminds me, don't forget to empty the sharps containers before you leave.
Will do. See you tomorrow, Carol.
What seems to be the problem, Tommy?
My arm really hurts.
I see. Where exactly does it hurt?
All over, but especially the elbow.
Okay. Do you know what happened to make it hurt?
I was playing soccer and fell on my arm.
Yeah, that's likely the problem. Does it hurt anywhere else?
No, just my arm.
Okay. I think it's just an elbow sprain, but we'll take some x-rays to make sure.
Hi, Jessica. What brings you in today?
My back hurts.
All right. Where does it hurt exactly?
It's just the small of my back.
Any pain near the shoulder blades or neck?
No, that part doesn't hurt.
I see. Does it only hurt when you bend over?
No, it hurts when I wake up in the morning, too.
Okay. I'll take a look and see what I can find.
Hi, Dr. Stevens. I just saw the patient in room 7.
Ah, yes. How is she doing?
She has several facial injuries. Most are just scrapes.
Okay. Where are the scrapes exactly?
There are a few above the left eye.
Above or below the eyebrow?
Above the eyebrow, on the forehead.
I see. Is that all?
No, there is a deep wound near her left ear that looks serious. She may need stitches.
Thanks, Ben. I'll take a look.
Good morning, Miss Simmons. I've taken a look at your chest x-rays.
Yes? And what did you find?
I'm sorry to say it appears to be emphysema.
Oh, really? I thought it was just my asthma.
Well, you've had asthma for years, but this is an entirely new condition.
Can it be cured?
Unfortunately, emphysema is incurable, but there are treatments that can slow its progression.
I hope they work. I just want to be able to breathe well.
Mr. Robinson, your blood pressure is really high. You're at increased risk for a heart attack.
Could you explain exactly what happens during a heart attack?
Certainly. Usually, an artery inside the heart gets blocked by fatty acids.
That doesn't sound good.
No, it's not. When that happens, blood can't get through. That can lead to permanent damage or death.
Oh my! What are the symptoms?
Sudden chest pains or difficulty breathing. Call the hospital immediately if you have them.
I will. Thank you, doctor.
Hi, Mr. Harvey. You're here because of the stomach pain. Is that right?
Yeah, it's the same pain as a week ago.
All right. You know, we're probably going to have to do a colonoscopy.
Really? Do you think that's necessary?
It's a good idea if you're having persistent lower abdominal pains. We should check for any problems.
Okay, you have me convinced. What needs to be done?
Briefly, we'll insert a fiber optic camera into the rectum. While the camera is being withdrawn, we'll find the problem.
All right. Better safe than sorry.
Hello, Bill. What's troubling you today?
My finger really hurts.
Let me take a look at it. Yes, it's all red with a blister. What happened?
I touched a hot stove.
I see. Did anyone provide first aid?
Yeah, I ran some cold water over it.
Well, it probably helped. It should be fine in a few days. Just put aloe vera on it.
Thank you, doctor. I'll try to be more careful.
Hey, Susan, can you take a look at these notes from Dr. Downing? I just can't read his writing.
It is pretty messy sometimes. Let's see.
Look, is this C-O or O-E?
It's hard to tell, but I think it says patient COSOB.
Ah, that makes sense. I can see it now. And this is the diagnosis here?
Yes, it says DXHTN.
So the patient has hypertension?
That's right.
Hey, Mark, I have a question about Mr. Paul's medication.
Yes, Nancy, what's up?
This note calls for 3 drops in each eye twice a day. That seems a little high.
That's right. They're a little higher than usual. Mr. Paul has a bad infection.
Oh, so that's why there's this new antibiotic here. He'll take 50 milligrams once a day by mouth.
Right. He'll take it until the eye infection goes away.
All right, that's all I wanted to know.
Okay, thanks for checking with me.
Cindy, let's review these patients' meds before I head out.
Sure thing, doctor.
Miss Fulton should receive 150 milligrams of antibiotics twice daily.
Should that be administered PO or through an injection?
An IM would work better. Second, Mr. Brown can have aspirin if he asks for it, but not more than 600 milligrams per day.
Okay. He'll want to take that sublingually, right?
Yes, he can't chew tablets.
Got it. Thanks, doctor. Have a good night.
Sharon, Mr. Walker is a new patient. Let's review his meds.
Okay, doctor. What does he need?
He needs a 150 milligram dosage of these antiviral pills.
Sure. And how often should he get those?
They should be taken TID, preferably AC, before they bring his food.
I understand. Anything else?
He can also have 2 tablets of ibuprofen PRN for his pain, but not more than 800 milligrams per day.
Got it. I'll add it to his chart.
Well, Mr. Larson, you have a cold. It's a fairly common strain. You should recover in a day or 2.
Okay, I hope I don't give it to my granddaughter.
It is a highly contagious illness. Do you live in the same house?
Yes, she's visiting for the holidays.
Well, make sure to wash your hands regularly and use antimicrobial soap.
I will. Is there anything else I can do?
You could wear a face mask for a few days. I'll give you a few to take home.
Okay, Mr. Lewis, we're almost done taking your blood. Hold still for a little longer.
Sure. So where will my blood go?
Our facility provides blood to local hospitals and surgical centers for transfusions.
I see. So anyone might receive my blood?
Not quite. Your blood is type A, which means that it's only compatible with other people who have types A and AB. We can't give your blood to someone with type O or B.
Really? What happens if someone gets a transfusion with the wrong type?
That can be very dangerous or even fatal.
Wow. So you have to be pretty careful about labeling, don't you?
That's right. We keep very careful records here to make sure no one gets the wrong blood type.
So, James, it looks like you've developed acne. Have you heard of it before?
Yeah, but I don't know much about it. Is it bad?
It's not too bad. It's actually quite common in teenagers.
What causes it?
Oils that become trapped in the skin's pores cause it. This is why the pimples form.
Can we make it go away?
The best thing for you to do is to wash your face twice a day. Can you do that?
Yeah. Should I use special soap?
Yes, I'll give you some to take home.
Is that all?
Well, we can start with some topical medicine. If that doesn't work, I'll give you a prescription for some pills.
Class, let's see if you've been studying the nervous system. Elizabeth, would you answer a few questions for me?
Certainly, Professor.
First, what are the connections between neurons called?
Those are synapses, Professor. They enable the transfer of information.
Very good. And what types of signals do synapses send?
They send chemical or electrical signals to another cell.
Right again. So tell me, about how many synapses are there in the average brain?
That's a tough one. I would guess about 100 billion.
Not quite. It's actually many times that. 100 to 500 trillion.
Wow, that's a lot of synapses.
Indeed. All that information exchange is what makes the brain so powerful.
So, James, it looks like you've developed acne. Have you heard of it before?
Yeah, but I don't know much about it. Is it bad?
It's not too bad. It's actually quite common in teenagers.
What causes it?
Oils that become trapped in the skin's pores cause it. This is why the pimples form.
Can we make it go away?
The best thing for you to do is to wash your face twice a day. Can you do that?
Yeah. Should I use special soap?
Yes, I'll give you some to take home.
Is that all?
Well, we can start with some topical medicine. If that doesn't work, I'll give you a prescription for some pills.
David, let's see if you can identify Mr. Stone's condition.
Okay, doctor. What are his symptoms?
He has extreme fatigue and feels lightheaded. He has lost weight and suffers from diarrhea and nausea.
That sounds serious. Is there anything else?
He's lately had a strong craving for salty foods.
That's interesting. Based on those symptoms, my guess would be that Mr. Stone has Addison's disease.
Well done. And what is the cause of this disease?
It's a rare endocrine system disorder. It occurs when the adrenal glands don't produce enough hormones.
Very good. How is this disease treated?
Since it's a chronic disease, treatment will be lifelong. It involves regular steroid replacement therapy.
Right again. You're doing well, David. Let's move on to the next case.
Okay, Ms. Ryan. I have a few questions before we get started with your physical exam.
Oh, sure. What do you need to know?
Let's see. First, are you sexually active?
Yes, I am.
And do you use contraceptives?
Well, I try to.
Try to?
Well, I use them most of the time.
Ms. Ryan, it's very important for you to use a contraceptive every time. If you don't, you could end up with an unwanted pregnancy, and you're putting yourself at risk for STDs.
I know. I guess sometimes I just forget.
I see. So you forget your birth control pill, or you forget to use a condom.
Condoms. I don't take birth control pills.
Well, you should use one every time you have intercourse. But I'm going to recommend another form of birth control too.
Well, James, it looks like you're suffering from kidney stones.
Kidney stones? What are those?
A kidney stone is a small collection of minerals that forms in urine. Many people get them and never even notice.
Then why am I in so much pain?
Well, here's what happened. Since your urine has such a high content of these minerals, the stones got too big to pass through your urethra.
Oh, I see. So they're getting stuck?
That's right. The pain you feel is your body trying to push the large stone through a space that is too small.
No wonder it hurts so much. What should I do?
Drink lots of water. I know it hurts, but we need to get your body to expel those stones. And I'll prescribe something to help ease the pain.
The doctor will be in shortly, Miss Granger. While you're waiting, I have a few questions about your past medical history.
Of course. What do you need to know?
You wrote on the form that you're suffering from chest pain.
Yes, I've had this problem on and off for years.
Do you remember when exactly the onset of the problem was?
Let's see. I think I first noticed it about 6 years ago.
Have you ever been treated for the condition?
No, I did see a doctor once about it, but he couldn't find the cause.
Does anyone in your family have a history of heart problems?
No, not that I know of. Do you think that could be the problem?
We don't know anything yet. We just want to get as much information as we can so the doctor can make an informed diagnosis.
What's the trouble today?
Well, doctor, I don't feel well at all. I'm sure I have the flu.
I'm sorry to hear that. Have you been coughing?
A little, but mostly I'm wheezing. It's hard to breathe.
And have you noticed that your nose is runny?
Oh, yes. I've been blowing my nose constantly.
Okay. Do you have pain throughout your body?
I do have muscle aches, and I'm so tired that I can hardly do anything. Do you think it's the flu, doctor?
Well, you have a pretty high fever. It looks like you're right about the flu. You'll need plenty of rest, and I'll prescribe something to ease the symptoms.
Okay, Cheryl. I'm going to ask that you lie down on the table. I have to do an inspection of your abdomen.
All right. Like this?
Yes. Just put your arms at your sides and relax.
Do you think something is wrong with my stomach?
No. I just want to do some auscultation and percussion tests to make sure. Take a deep breath. I'm just checking that nothing feels swollen. Exhale. Okay. Next, I'm going to tap right here on your stomach.
Why do you do that?
This is a test to detect excess abdominal fluid.
Is there any?
Nope. It all looks normal.
Hello, Mr. Reed. I have your kidney test results back.
How do they look?
Unfortunately, the results are serious. First, according to the GFR test, your GFR level is 40.
So, is that too low?
Yes, it indicates a moderate case of kidney disease.
Well, at least it's not severe, I suppose.
No, but it could be headed that way. Also, according to the BUN test, your BUN level is rather high. That could be a dangerous combination with a low GFR rating.
I see. So what do we do?
We need to perform a renal biopsy as soon as possible.
Okay. When should I come in for that?
Dr. Roth has cleared some time for you 2 days from now.
That's fine. Thanks for all your help.
Suzanne, we're going to start off by taking an x-ray of your brain. Maybe that will show the cause of your headaches.
Okay, doctor. What if that doesn't work?
Then we might need to do a CT scan. Have you ever had one of those before?
No, I haven't. Could you explain it to me?
Sure. It's a type of radiography, but we take many different x-rays.
I see. Is that it?
No. Then a computer combines the x-rays into a three-dimensional image. We can work with the image to see many different things.
That sounds really powerful.
It is. It's expensive, though, so we'll start with the x-ray and see what that tells us.
How long will it take to get the x-ray?
Radiology should have it for us in about an hour.
Okay. Thank you, doctor.
Okay, Brian, you're all set to go home now.
Thanks for taking care of me, doctor.
No problem. But before you go, I need to tell you how to take care of that broken arm.
Okay. I hope it's not too hard.
Not really. Here's what you have to do. You want to elevate the arm to ease the swelling and pain.
I can do that. What else?
If it still hurts, you can put an ice pack on it for a few minutes at a time. Put a towel in between the pack and your cast.
That's easy enough. Will I need physical therapy?
Yes. I'm going to refer you to Dr. Rossman. He specializes in therapy after broken bones.
When should I make an appointment with him?
You can start working with him as soon as your cast comes off.
Sounds great. Thank you very much, doctor.
Hi, Beth. How many appointments do we have for this morning?
Hello, doctor. We have 3 appointments set up so far.
Great. When is the first one?
The first appointment is at 8. Michael Taylor is coming in for his asthma treatments.
Good. When is the next one?
Then you have a 3-day-old infant at 9. She's still showing signs of jaundice.
Oh, that's right. I'll have to get the Billy light ready. Is there another appointment after her?
Yes, you have a teenager with obesity. He is coming in for a checkup, but not until 11.
Okay. Can we push the 9 o'clock back to 9:30?
Sure, I'll give the mother a call now.
Great. And let me know if you set up anything else.
I will, doctor.
Thanks, Beth.
Sherry, let's talk about a couple of the patients in this wing before we start rounds.
Sure. What do I need to know?
First, Mr. Bauman hasn't been too mobile recently. You might have to help him around a bit.
Okay, that's no problem.
Also, do a quick check for bed sores.
Sure thing. Who's next?
Ms. Clark has recently started a new medication. You might have to read the label and make sure she understands it.
What medication is she taking?
She's on cortisone for an irregular heart rhythm. While she's taking that, she can't have any Zocor for her cholesterol. That could cause a dangerous interaction.
Okay, I'll make sure she knows to stay off the Zocor.
Good. The rest of the patients require standard care.
That sounds fine. Let's get started. Well, Dr. Matthews, let's talk about your background.
Certainly, ma'am. I think you'll find that I'm very well qualified.
I hope so. Let's see. It says here you attended James Perkins Medical School.
That's right. I graduated at the top of my class.
That's excellent. We're always looking for the best and brightest here. What about your residency?
I completed an orthopedic surgery residency at St. Margaret's Hospital.
Well, we do need someone with that emphasis. And how long have you been licensed?
I passed the medical exam last year, and I've been practicing for the past 8 months.
So, you don't have a lot of experience in actual practice.
No, but I'm a quick learner, and the program at St. Margaret's gave me lots of real-world experience.
Okay, Dr. Matthews. I'll review your qualifications with the board, and we'll get back to you this week.
Hey, Wendy, is Mr. Williams due for his medication?
I don't know. What does his medical record say?
Well, I'm not sure. I can't read these notes.
Let me see. Wow, this doesn't make any sense. I think he's supposed to get his meds every day at 9 a.m., but it doesn't look like he's had any dosages for the last 3 days.
Really? That can't be right. How could that happen?
Wait, I think I see what happened. These notes aren't in chronological order. Someone entered last week's dosages first, after this week's. It's all mixed up.
So did he get his medication today or not?
I'm not sure. Who was on duty at 9 a.m.?
I'll check the shift board. Tom was here this morning.
These notes are a mess. We'd better give him a call.
That's a good idea. We certainly don't want to give Mr. Williams the wrong dosage.
Dr. Fox, do you have a minute?
Sure. What is it about?
It's about a patient. I'm having trouble communicating with him.
What do you mean?
Well, he's complaining of constant nausea. I asked about his medical history, but he didn't say much.
Is it just a miscommunication? Maybe he doesn't know what you're asking for.
It's possible, but I can't tell because he's barely speaking to me.
He might just be anxious. It can be scary to feel terrible but not know why.
Yeah, he does seem pretty nervous. In fact, I noted that as an additional symptom.
Did you use lots of jargon? In my experience, that makes things worse.
I might have. Since he has nausea and anxiety, I asked him if he has a history of hypoglycemia.
See, the term may not mean much to him. Try low blood sugar instead.
Good point.
Also, make sure to establish a rapport, even just by asking about his day.
Oh, I didn't really do that. I just jumped in with my questions.
It's important. It really helps the patient relax.
Hi, Louise. What are you doing here? I thought your shift ended an hour ago.
It did, but I have to finish this paperwork. I'm way behind.
Tell me about it. I came in on my day off last week to finish mine.
We have too many patients in this department. It's not good for us or for the patients.
I know. I asked the director if we're going to get another doctor, but she said there's not enough money in the hospital budget to hire anyone.
The whole situation is terrible. I wish I could take a vacation, but I need the money to pay off my student loans. Besides, if I left, I'd just be even more behind in the caseload when I got back.
Yeah, I know what you mean. I worry about my kids because I'm hardly ever home anymore.
That's tough. Well, I'd better get back to this paperwork so I can get some rest tonight. I'm working a double shift tomorrow.
Sure, Louise. Good luck.
Good morning, Ms. Lewis.
Hello?
Okay. At your last appointment, you said you were getting headaches. Is that still the case?
No, I'm having knee problems now. The pain is constant.
On a scale of 1 to 10, how would you rate the intensity of the pain right now?
Right now, it's moderate, like a 3.
And how does it feel at worst?
At worst, it's excruciating, especially after I exercise. I've had to cut back a lot. I used to run every day.
I see. That may be the cause of your knee troubles. Now, can you describe how it feels? Does it burn or throb?
Mostly the pain is throbbing. Occasionally I get a shooting pain.
It goes through your knee?
No, it extends down into my leg.
Let me make a note of that. Last question. How do you treat this pain at home?
I usually put an ice pack on it. Do you think I'll need surgery?
Well, Dr. Samuels will be able to talk to you about that. It'll be just a few minutes while I get him.
Thanks.
Mr. Anderson, it's a good thing you came in.
Yeah? I feel pretty awful.
Well, it seems that you've come down with endocarditis. Do you know what that is?
I have no idea, but it sounds serious.
It is. Basically, the lining of your heart is inflamed.
Oh, that's bad. Can we treat it?
Yes. I'll start you on some antibiotics immediately. But this could have been avoided.
Really? How so?
Well, you've had a sore throat for quite some time, haven't you?
Yeah, but I figured it was just a cold.
Definitely not. It's caused by strep bacteria. Normally, that's an acute condition that we can knock out pretty quickly.
Okay, but how did that cause my other condition?
Untreated, the infection moves to your heart, which it appears to have done. And now we have to get rid of that infection before it causes lifelong complications.
Lifelong?
Yes. Unfortunately, endocarditis can become a chronic condition. It can damage your heart, brain, and liver.
Well, Mr. Garner, the test results are in. It's just as we suspected, type 2 diabetes.
Honestly, I'm not surprised.
That's right, there's a family history of diabetes.
Yes, my father had it.
I see. You should be pretty familiar with the treatment process then.
A little. My dad had to take a lot of insulin shots. Will I need to do that?
Not necessarily. We'll start with a lifestyle plan and see how that works.
Okay. We were always buying Dad sugar-free candy. Is that what I have to eat now?
Actually, no. Small amounts of sweets and chocolate can be part of a healthy meal plan, just like for everyone.
That's good. Will I have to do a lot of extra exercise to keep my weight down?
Not necessarily. You really need the same amount of exercise any healthy person needs.
Well, I can't say I do the recommended amount now. I suppose this is a good reason to start.
Absolutely.
Hello, Mr. Paxton. I'm glad you could come in.
Well, I really want to hear about my cancer treatment options. I'm pretty nervous.
That's totally natural. We have a few therapy options available.
I'm all ears.
Great. First, there's always chemotherapy. You would receive regular doses of strong drugs to kill the cancer cells.
I know a little about chemo. Aren't there some nasty side effects?
There can be. You'll likely feel nauseous and lose most of your hair. It can damage some other bodily systems too.
That's not very appealing. Is there another option available?
Well, at your early stage of cancer, we may be able to try photodynamic therapy.
I've never heard of that.
It's relatively new, but has had some good results. We give you a cancer-killing drug that reacts to light. Then we shine a light beam on the tumor, which has absorbed the drug.
That sounds interesting. What would you recommend?
We can certainly try photodynamic therapy. You'll likely need chemo as well, but hopefully not as much.
Well, Mr. Jameson, I've reviewed your symptoms.
And what do you think?
Well, it could be something serious, or it could be something relatively simple.
I see. So what's the serious possibility?
It could be coronary artery disease.
Wow. And what's the simple possibility?
That it might just be an arrhythmia.
Shouldn't we be able to tell what I have just from my symptoms?
Well, they have some of the same warning signs, like the shortness of breath and fast heart rate you've had.
So what types of treatment am I looking at?
It depends on your diagnosis. If it's coronary artery disease, it could be treated with lifestyle changes and drugs. Surgery might be necessary.
Really? It's that dangerous?
Yes, it could lead to a fatal heart attack.
That's scary. What if it's an arrhythmia?
Well, some cases require no treatment at all. Others need medication.
Then I hope it's just an arrhythmia.
Me too, but we'll have to run a few tests to find out.
Do we have any serious trauma patients in the ER right now, Sandy?
Thankfully, no. There are 2 patients waiting to be seen, however.
Okay, tell me about their conditions.
First, there's Carl Henning, 67. He came in complaining of a mild fever.
I see. Does he have any other symptoms?
None that the triage nurse could identify.
That's good. His age is a bit of a concern, though. To be safe, we'll put him on IV fluids. Tell me about the other patient.
That's Sarah Crane, 14. She has an open wound on her arm. She got it in a bad bicycle accident, apparently.
What's the current state of the wound?
It stopped bleeding, but needs to be examined.
All right. Well, we'd better take a look at Sarah's arm first. I wouldn't want her to get an infection while waiting.
Very well, doctor.
I'm sure she'll need stitches. Please grab a suture kit and meet me there.
Sure, I'll be right there.
Okay, let's talk about Mr. Harris. He checked in with a staph infection, right?
Yes, that's right.
And how is he doing today?
I'm afraid to say his condition is getting worse.
Really? How so?
Well, the red, swollen wounds on his body are now filled with pus.
Anything else?
Yes, he said that he was short of breath, and his temperature is running high.
I'm afraid it may be MRSA. We need to start him on an aggressive round of antibiotics, and he needs to be in isolation.
Right. I'll get started on that right away.
Has anyone else in this unit been infected?
We ran some diagnostic tests on the other patient in Mr. Harris' room, but his test results came back negative. None of the other patients are exhibiting symptoms.
Well, let's keep it that way. Remind everyone to wash their hands or use an alcohol-based hand sanitizer.
Of course. And we're disinfecting Mr. Harris's room right now.
Good. I'll check on him again before the end of my shift.
Jane, I'm Richard Jensen. I'll be interviewing you for the RN position.
Nice to meet you, Mr. Jensen.
So, what kind of experience do you have?
Well, I started volunteering in hospitals as a teenager. I've worked as an RN for the past 10 years.
And why did you go into nursing?
I love taking care of people. It brings me a lot of joy.
Excellent. Now, this is a general practice. You'll be giving lots of vaccines and assisting with annual physicals.
Everyday tasks. I understand.
Is that appealing to you?
Yes, because there's more interaction with patients. Hospitals are too fast-paced.
Right, it's definitely slower here. But we still have to maintain patient flow.
Of course.
Now, have you worked with electronic health records?
Yes, we switched to them several years ago.
OB triage unit, how can I help you?
Hi, I'm at 38 weeks and I'm experiencing some contractions. I think I might be in labor.
Okay, stay calm. Have you noticed an increase in discharge?
Yes, a little bit.
Do you know if your water broke already?
No, not yet.
All right. Are the contractions becoming more frequent?
Yes, they are. They were about 15 minutes apart, but now they're about every 10 minutes.
Okay. Those don't sound like Braxton Hicks contractions. I think you are in the early stages of labor, but it's still not quite time for you to come in.
Really? It's starting to get painful.
Don't worry, that's normal. But we recommend waiting until the contractions are about 4 minutes apart.
Oh, okay. Is there anything I need to do until then?
Just rest and stay as comfortable as you can. And make sure you have a bag packed with everything you need.
I've got one.
Great. So hang in there and keep timing those contractions.
Okay, and should I go to OB triage when I'm ready to come in?
Yes, you should.
Okay, so we've covered the central nervous system and the peripheral nervous system. Let's get into neurological disorders. What are some signs of trouble in the nervous system?
Well, I know that vertigo is a big sign.
That's not always true, you know.
I'm not sure that I follow.
Let me explain. Vertigo can be an indicator of a problem with the brain, but it's often a sign of inner ear problems.
Oh, I see. So you're thinking of something more along the lines of seizures or paralysis?
Yes, exactly. Those point directly to a problem with the nervous system. But please, explain what those are.
Sure. Paralysis occurs when a patient loses the ability to move muscles, and seizures result in uncontrolled muscle movement.
Good. Now, what's an example of a disorder that doesn't just involve muscle control?
Well, there's Alzheimer's disease.
Good example. It leads to physical and mental deterioration.
Sam, could we go over tomorrow's surgery schedule?
Sure thing, Doctor. First up is a bowel resection for Paul Jackson at 7 o'clock.
Ah, yes. Is there anything else scheduled for the rest of the morning?
You are supposed to perform a gallbladder excision on Amanda Burns at 10 o'clock.
Right. The cholecystectomy. That could be a problem. I think Mr. Jackson's resection could take a while.
Why is that, Doctor?
I remember the abdominal CT scan showing the tumor to be quite large and advanced. I need to allow time for complications.
I see. What should we do then?
Well, we may need to push back that procedure by a couple of hours.
Okay, let's see here. There's an operating room open at noon.
That would be perfect. Who's the anesthesiologist for that operation?
Dr. Gibbons is slated to work with you on that.
Good. Please let Dr. Gibbons, Ms. Burns, and the nursing staff know about the change.
Will do. See you tomorrow, Doctor.
AVN Pharma Education.